inverted papilloma. Sinonasal papillomas are benign epithelial neoplasms arising from the Schneiderian mucosa. The three subtypes are exophytic, oncocytic, and inverted, and these should be distinguished from one another histopathologically. Schneiderian epithelium is a unique lining of the nasal cavity and paranasal sinuses. It is ectodermally derived ciliated columnar epithelium with goblet cells. It differs from the similarly appearing respiratory epithelium, which is endodermally derived. It is named after Conrad Victor Schneider, a German physician from Wittenberg in the 1660s. Schneiderian papillomas arise from this epithelium, which is a unique lining of the nasal cavity, ectodermally derived ciliated columnar epithelium with goblet cells. The inverted and exophytic type are the most common, with the inverted type having an 8% rate of malignant transformation in this study, whereas the oncocytic type is not associated with dysplasia or malignancy, and despite reports in the literature indicating malignant potential. The history of chronic rhinosinusitis and papilloma location can provide clues to the histologic subtype, which is important for surgical planning and patient. What is an inverted papilloma? An inverted papilloma is a subtype of Schneiderian papilloma that occurs in the mucosal lining of the nasal cavity and paranasal sinuses. These are generally benign epithelial tumors that sometimes appear similar to a nasal polyp. However, inverted papillomas can disrupt adjacent bony and rarely transform into a malignant cancer, and this rate of conversion can be as high as 15%. The tumors usually occur on one side, although inflammatory changes can happen on the other side. Papillomas are benign epithelial tumors that grow outward in finger-like projections in the nose. In inverted papillomas, these projections grow inwards into the underlying bone, and they are locally aggressive and often recur and can become malignant. Squamous cell carcinoma is the most common malignancy associated with inverted. What are the common symptoms? These include running nose, nasal obstruction on the side of lesion, recurrent sinus infections, and facial pressure, and occasionally nose. A complete removal of the lesion and bone peripheral border filing are essential to perform a correct and definitive treatment. Careful preoperative planning coupled with meticulous surgical technique are absolute requisites for successful management of these difficult tumors. Sinonasal papillomas.